Assalamu alaikum, dear students. This is your sixth lecture of general anatomy. The topic is anatomy of the autonomic nervous system. I am Dr. Kalimullah, Demonstrator Anatomy Department, GKMC Swabi. The autonomic nervous system, in short, we can say ANS, is an involuntary motor system. It is accompanied by the sensory afferent fibers. It supplies the smooth muscle, the cardiac muscles, and the glands. The autonomic nervous system controls involuntary activities of the body. For example, sweating, salivation, peristaltic movements of the intestine, and vasomotor activity of the blood vessels. Some differences in the autonomic nerve fiber and the somatic nerve fiber. The autonomic nerve fiber, when it leaves the central nervous system, it relays or it synapse in a ganglia. Then it leaves the ganglia and reaches the effector organ. The fiber before the ganglia is called preganglionic fiber, and it is myelinated. And the fiber after the ganglia is myelinated, and it is called postganglionic fiber. The somatic nerve fiber, in the way of the somatic nerve fiber, right from the CNS toward the effector organ, there is no ganglia in which it relays, and it reaches the directly the organ as a myelinated fiber. The difference which I told you in the last slide, you can very well see in this diagram. The somatic neuron has no ganglia in its way, while the autonomic motor neuron has a ganglia in which there is preganglionic fiber and postganglionic fiber toward the effector organ. The divisions of autonomic nervous system. These are sympathetic and parasympathetic. The sympathetic activities, these are widespread, diffuse, and they combat the acute emergencies conditions. Parasympathetic activities, these are discrete, isolated, and they provide a comfortable environment. Both are in absolute coordination and adjust body involuntarily to a given situation. In this picture, you can see the sympathetic nervous system is in action. Mainly, it is concerned with mobilization of the body's resources under stress to induce the fight or flight response, and you can see the fight or flight response. Now, the sympathetic nervous system, the anatomy of the sympathetic nervous system. It is also called thoracolumbar outflow because it starts from thoracic segment 1 through thoracic segment 12 up to lumbar 2 segments. They arise from the lateral horn cells of the spinal cord. Their myelinated preganglionic fibers, white rami, they emerge through the ventral rami, where white rami are connected to the sympathetic chain ganglia. The sympathetic chain ganglia, this is a long vertical ganglionic chain present on both sides of the spinal cord. The sympathetic fibers, they either relay in the sympathetic chain ganglia, and the postganglionic fibers leaves toward the effector organ, or it does not synapse in the sympathetic chain ganglia and synapse somewhere in the collateral ganglia, and the post ganglionic fiber leaves toward the effector organ. A third option is it does not synapse somewhere in the or there is no ganglia in the way and directly goes to an organ that is called the adrenal gland, and its fibers end upon the adrenal medullary cells from where they release the hormone adrenaline. The sympathetic fibers to the adrenal medulla passes directly and releases the noradrenaline. Exceptions to this general rule are the cholinergic sympathetic nerves. The cholinergic sympathetic nerves, they pass toward the sweat glands and the skeletal muscle vessels for vasodilatation, where the sympathetic fibers releases cholinergic acetylcholine, which is the secretion of the parasympathetic nerve fibers. Functional activity of the sympathetic fibers: vasomotor to constrict the blood vessels, pseudomotor to secrete the sweat, pyelomotor to contract the erector pylorus muscle of the hair. Other functional activities of the sympathetic fibers are pupillary dilatation, any uh, pupils are dilated, face become pale due to vasoconstriction, and dry mouth, tachycardia, rise of the blood pressure, inhibition of hollow viscera, closure of perineal sphincters in the perineal region, the closure of the sphincters. The parasympathetic nervous system. It is composed of the cranial nerves 3rd, 7th, 9th, and 10th, and the sacral spinal segments is 2, is 3, and is 4. That is why this is called the craniosacral outflow. The 3rd, 7th, and 9th cranial nerves, their fibers goes to the ciliary, sphenopalatine, submandibular, otic ganglion successively, and supplies the head region and the oral region. The 10th cranial nerve, that is the vagus nerve, it supplies the entire thoracic region organs and the abdominal organs, except some area of the colon, which is and the urinary bladder, which is supplied by the sacral segment 2nd, 3rd, and 4th. The functions of parasympathetic nervous system. It is responsible for specifically for stimulation of activities when the body is at rest, and it conserves the resources of body for long-lasting efficacy. The parasympathetic nerve fibers, their preganglionic fibers are very long, while the postganglionic fibers are short. The fibers of the terminal ganglia are located mostly even within the wall of the viscera. The nerve endings, they release the uh, acetylcholine. Therefore, these nerves are also called cholinergic nerves. In contrast, the sympathetic fibers are called adrenergic because they release norepinephrine or adrenaline. The parasympathetic activity. The subject is fully relaxed with constricted pupils, face flushed, moist mouth, pulse slow, BP low, bladder and gut contracting, sphincters are relaxed. In general, it conserves and stores the energy sources of the body. The role of parasympathetic and sympathetic nervous system in homeostasis. In a normal subject, there is a balance between both systems to maintain homeostasis. Okay, students, thank you very much for listening me, and I hope you would have followed me. Thank you.